So, you're looking to get your teeth professionally whitened? Well, then stay tuned. My name is Chris, and I am a registered dental hygienist, and you are watching BURSTtv. The holidays are approaching, and you're getting ready for the holiday photos, or you're getting ready for a huge trip, and you look in the mirror and you're just like, whoa, my teeth aren't as bright as they should be. So, people usually opt for the in-house whitening because it's quick, it's usually a one-time treatment, and it's instantaneous. In my office, we always set aside at least 2 hours of the bleaching process because it usually takes a while for us to prep the mouth. First, we clean the teeth. We use a pumice paste, which is a really gritty paste that takes off any leftover plaque, any staining, make sure that the teeth is nice and smooth. And once we clean off the teeth with that paste, we're gonna go ahead and start isolating the soft tissues from the teeth. So we use a cheek retractor, we'll use gauze, and then once that is completed, we will go ahead and use a desensitizing agent just to kind of paint over the teeth, just to kind of help, protect the teeth once it's going through the process of the bleaching, because sometimes it can be a little sensitive. Once that's done, we go ahead and place a painted dental dam. So this is where we really isolate the gums from the teeth. So we paint on this dental dam along the gum line, scallop it along the teeth, and use a curing light to harden it so that way it stays put throughout the entire process. And once that's done, we are about ready to do the whole bleaching. In our office, we do 3 15-minute sessions of the actual curing light. So we have a curing light system that we shine on the patient's teeth. So once we put the bleaching on the teeth, we go ahead and shine that light, let it sit for 15 minutes, check on the patient, see where we are, and then take it off and then reapply again, and then they go on for another 2 sessions. So sometimes we do 4, just depending if they want it even wider, but usually by 3, they get that achieved bright look and then they're satisfied, and that's it. And so we always make trays for them that they can use to touch up on their own, and usually you want to touch up every 3 to 4 months, kind of like whitening strips. So with any whitening process, you just want to touch up every 3 to 4 months. But they leave the office with a much brighter smile before they got it done, and they're happy. Things to consider before getting your teeth whitened. You want to make sure that your teeth are healthy. You want to make sure you don't have anything else going on. If your tooth has decay and it's exposed and you get bleaching on it, it's not going to feel good. You want to make sure that you have a good checkup with your dentist, or at least have the dentist take a look at your teeth and give you the go. And also, the best time to whiten your teeth is after a good cleaning. Always make sure you brush and floss before you get your teeth whitened. Other considerations to know is tooth sensitivity. Everyone's mouth is very different, and everyone's sensitivity tolerance is also very different. So talk to your dental professionals, let them know your concerns, and they'll guide you to the right procedure. But yes, sometimes you will get tooth sensitivity when you are whitening because the percentage of the peroxide is going to be a lot higher, and it's going to be, administered all at once in that one appointment, and you're shining the light about 2 or 3 sessions. So it's going to be a little sensitive. So just be aware of that. Also, gum and tissue irritation. So that's why it's really important for us dental professionals to really isolate the soft tissues from the teeth. But it happens. Your mouth is tired, you move a little bit, you might get a little bit of bleaching agent on your cheek. It's going to sting a little bit, but it won't last forever. So just be aware of that. Another expectation is not everyone's mouth is going to look the same. It's because everyone's mouth is very different. You're not going to look like the next person. Just know that, some people have discolorations, whether it's due to tetracycline or fluorosis. People have splotches, white spots, just different things going on with their mouth. So don't be alarmed if it doesn't look like what you see on someone else or on TV or whatever. But just know that whatever whitening you get, it should be able to kind of even out what you have and give you still that satisfactory smile that you deserve. Also, after whitening, make sure that you stay away from any dark staining food, drinks for at least 24 to 48 hours. Okay, so yes, no coffee, girl. No. Or red wine. Smoking. Why? Because your teeth are extremely vulnerable at this point. They're very porous. So anything outside the environment can attract to the teeth. And so just gotta be aware when it comes to eating those favorite foods that you like tomato sauce, blueberries, especially coffee and tobacco products. And one more major tip is always brush and floss daily. The more you keep up with your oral hygiene at home, the better your whitening will last. I hope this video was helpful, and again, make sure you always talk with your dental professional about any whitening procedures and which one will be the best for you. Thank you guys for watching, and stay tuned for more BURSTtv. Bye!